Which of the following is an early sign of hypoxia, low oxygen levels in a patient? Confusion, cyanosis, bradycardia, edema. The correct answer is option A, confusion. Which part of the brain is primarily involved in processing emotions? Cerebellum, amygdala, hippocampus, medulla oblongata. The correct answer is option B, amygdala. Which rib fractures are commonly associated with splenic or liver injuries? Ribs 1 to 3, ribs 4 to 8, ribs 9 to 12, ribs 7 to 9. The correct answer is option C, ribs 9 to 12. The fastest absorption of insulin occurs at which site of injection? Thigh, abdomen, upper arm, buttocks. The correct answer is option B, abdomen. Which hormone is most commonly associated with stress and anxiety? Serotonin, dopamine, cortisol, oxytocin. The correct answer is option C, cortisol. Chest pain that worsens when lying flat and improves when sitting up is a characteristic of which condition? Pericarditis, pulmonary embolism, esophageal spasm, myocardial infarction. The correct answer is option A, pericarditis. Which type of stroke is caused by a sudden blockage of blood flow to the brain? Ischemic stroke, hemorrhagic stroke, transient ischemic attack, aneurysm rupture. The correct answer is option A, ischemic stroke. Blood for ABG analysis is taken from which site? Femoral artery, brachial vein, radial artery, jugular vein. The correct answer is option C, radial artery. A patient on bed rest should be encouraged to perform which exercise to prevent deep vein thrombosis? Sit upright in bed, flex and extend the feet frequently, remain completely still, use a heating pad on legs. The correct answer is option B, flex and extend the feet frequently. What is the average duration of a full-term pregnancy? 30 weeks, 36 weeks, 40 weeks, 44 weeks. The correct answer is option C, 40 weeks. What is the term for the administration of a drug into the spinal cavity? Intravenous, intramuscular, intrathecal, subcutaneous. The correct answer is option C, intrathecal. Which instrument is used for the examination of the ear? Otoscope, stethoscope, ophthalmoscope, thermometer. The correct answer is option A, otoscope. Which condition is most likely to cause pleuritic chest pain that worsen with deep breathing? Angina, pulmonary embolism, aortic dissection, esophageal rupture. The correct answer is option B, pulmonary embolism. Small cell lung carcinoma is also known as non-epithelial cancer, neuroendocrine tumor, non-small cell carcinoma, sarcoma. The correct answer is option B, neuroendocrine tumor. What is the primary function of bile in the digestive system? To digest carbohydrates, to neutralize stomach acid, to break down fats, to stimulate saliva production. The correct answer is option C, to break down fats. What is the term for enlargement of lymph nodes? lymphedema, lymphadenitis, lymphadenopathy, none of these. The correct answer is option C, lymphadenopathy. Which type of isolation is required for a patient with tuberculosis? Contact precautions, droplet precautions, airborne precautions, standard precautions. The correct answer is option C, airborne precautions. Which pulse is typically used to assess the pulse in an unconscious patient? Radial pulse, carotid pulse, femoral pulse, dorsalis pedis pulse. The correct answer is option B, carotid pulse. Which pulse is palpated in the groin region? Dorsalis pedis pulse, popliteal pulse, femoral pulse, posterior tibial pulse. The correct answer is option C, femoral pulse. Which of the following is a key sign of hyperkalemia? Elevated potassium levels, muscle weakness, increased thirst, frequent urination, elevated blood sugar. The correct answer is option A, muscle weakness. Which pulse site is best for assessing circulation to the lower extremities? Radial pulse, carotid pulse, brachial pulse, dorsalis pedis pulse. The correct answer is option D, dorsalis pedis pulse. When performing a head-to-toe assessment, which of the following should be assessed first? Heart rate, respiratory rate, skin integrity, neurological status. The correct answer is option D, neurological status. What is the term for the highest range of temperature recorded in the morning and lowest in the evening? Inverse fever, hectic fever, fever spike, swinging fever. The correct answer is option A, inverse fever. Which of the following is a priority nursing action when a patient is experiencing a myocardial infarction? Administer oxygen and nitroglycerin, place the patient in a supine position, administer pain medication only, perform CPR immediately. The correct answer is option A, administer oxygen and nitroglycerin. Which assessment finding will most likely indicate dehydration in a patient? Increased urine output, moist mucous membranes, skin that tense when pinched, regular bowel movements. The correct answer is option C, skin that tense when pinched. Which of the following is the most common cause of chest pain in adults? Myocardial infarction, gastroesophageal reflux disease, pneumothorax, costochondritis. The correct answer is option B, gastroesophageal reflux disease. Which symptom would suggest a patient may be developing a urinary tract infection? Clear pale urine, decreased thirst, pain or burning during urination, increase in energy levels. The correct answer is option C, pain or burning during urination. Which of the following is the best action to maintain skin integrity in an immobile patient? Increasing calorie intake, ensuring the patient is turned every 2 hours, administering antibiotics, applying alcohol-based lotion. The correct answer is option B, ensuring the patient is turned every 2 hours. Which action is most appropriate to improve safety for a patient at risk of aspiration? Allow the patient to lie flat while eating, encourage talking during meals, elevate the head of the bed while eating, provide large bites of food. The correct answer is option C, elevate the head of the bed while eating. S1 is here best at the. The correct answer is option B. S1 is here best at the fifth intercostal space mid-clavicular line. Which catalyst is used in the Haber process for the production of ammonia? Platinum, nickel, iron, copper. The correct answer is option C, iron. In an AC circuit, the opposition to current flow due to capacitance is called resistance, reactance, capacitive reactance, inductive reactance. The correct answer is option C, capacitive reactance. Which material is commonly used in electrical heating elements? Copper, aluminium, nichrome, silver. The correct answer is option C, nichrome. Which of the following gases has the highest critical temperature? Nitrogen, oxygen, carbon dioxide, hydrogen. The correct answer is option C, carbon dioxide. In a diesel engine, ignition occurs due to spark plug, compression of air, external heat, high voltage. The correct answer is option B, compression of air. Natural rubber is a polymer of ethylene, isoprene, propylene, none of these. The correct answer is option B, isoprene. What is the primary purpose of a flywheel in a machine? Increase efficiency, regulate speed fluctuations, store electrical energy, reduce noise. The correct answer is option B, regulate speed fluctuations. The primary material used for manufacturing transformer cores is copper, aluminium, silicon steel, cast iron. The correct answer is option C, silicon steel. The function of a commutator in a DC motor is to supply power to the motor, reduce heat loss, reverse current direction, control speed. The correct answer is option C, reverse current direction. In a transformer, the core is made of laminated sheets to reduce copper loss, eddy current loss, electrical loss, mechanical loss. The correct answer is option B, eddy current loss. Most of the weather phenomena take place in the stratosphere, troposphere, mesosphere, thermosphere. The correct answer is option B, troposphere. For generating large current in generators, which winding is preferred? Wave winding, lap winding, progressive winding, series winding. The correct answer is option B, lap winding. The angle between the base of a gear tooth and the pitch circle is called backlash, pressure angle, module, none of these. The correct answer is option B, pressure angle. Which of the following polymers is an example of a thermosetting plastic? Polyethylene, bakelite, polystyrene, nylon. The correct answer is option B, bakelite. The phenomena of the splitting of light into its constituent colors is called reflection, refraction, diffraction, dispersion. The correct answer is option D, dispersion. The gear system used to transmit motion between non-parallel shifts is called worm gear, bevel gear, helical gear, none of these. The correct answer is option B, bevel gear. Which device is used to measure the specific gravity of a liquid? Barometer, hydrometer, hygrometer, manometer? The correct answer is option B, hydrometer. The process of electrolysis is based on magnetic force, Faraday's laws of electrolysis, Newton's law, Boyle's law. The correct answer is option B, Faraday's law of electrolysis. The device used to measure very high temperatures is called a hygrometer, thermocouple, pyrometer, barometer. The correct answer is option C, pyrometer. The phenomena of superconductivity occurs at room temperature, very high temperature, very low temperature, normal temperature. The correct answer is option C, very low temperature. In a 4-stroke engine, the power stroke occurs during intake, compression, expansion, exhaust. The correct answer is option C, expansion. Which type of waves are used in communication systems? Transverse waves, electromagnetic waves, longitudinal waves, surface waves. The correct answer is option B, electromagnetic waves. The primary advantage of an SCR is voltage control, high frequency switching, high power handling capacity, reduced size. The correct answer is option C, high power handling capacity. The working principle of a transformer is based on Ohm's law, electromagnetic induction, Lenz's law, Coulomb's law. The correct answer is option B, electromagnetic induction. In refrigeration, the coefficient of performance is defined as the ratio of work input to heat absorbed, heat rejected to work input, heat absorbed to work input to heat rejected. The correct answer is option C, heat absorbed to work input. Electroplating is an example of chemical bonding, oxidation reduction reaction, electrochemical process, ionization. The correct answer is option C, electrochemical process. The term mechanical advantage is associated with gears, levers, all simple machines, hydraulic systems. The correct answer is option C, all simple machines. The instrument used to measure the pressure of gases is hygrometer, manometer, barometer, pyrometer. The correct answer is option B, manometer. The force acting on a charged particle moving in a magnetic field is called gravitational force, electric force, centrifugal force, none of these. The correct answer is option C, centrifugal force. The main function of a capacitor in an AC circuit is to increase current flow, store electrical energy and improve power factor, convert AC to DC, increase voltage. The correct answer is option B, store electrical energy and improve power factor. Which type of lung cancer is strongly associated with smoking? Small cell carcinoma, adenocarcinoma, bronchoalveolar carcinoma, large cell carcinoma. The correct answer is option A, small cell carcinoma. Which gas commonly found in homes is the second leading cause of lung cancer? Methane, radon, carbon dioxide, nitrogen dioxide. The correct answer is option B, radon. The Allen test is used to assess which arteries? Radial and ulnar arteries, brachial and radial arteries, popliteal and tibial arteries, carotid and subclavian arteries. The correct answer is option A, radial and ulnar arteries. Which gland typically decreases in size and function with age and may eventually disappear? Thyroid gland, pituitary gland, thymus gland, adrenal gland. The correct answer is option C, thymus gland. What is the most common type of fracture in children? Spiral fracture, green stick fracture, simple fracture, transverse fracture. The correct answer is option B, green stick fracture. The flake sign is associated with which of the following diseases? Kwashiorkor, rickets, scurvy, pellagra. The correct answer is option A, Kwashiorkor. From positioning in ARDS, acute respiratory distress syndrome is used to reduce cardiac output, improve oxygenation, decrease lung compliance, prevent aspiration. The correct answer is option B, improve oxygenation. How long are the patient legs elevated during the Trendelenburg test? 10 seconds, 30 seconds, 1 minute, 5 minutes. The correct answer is option B, 30 seconds. What is a collapsing pulse also known as? Water hammer pulse, pulsus paradoxus, bounding pulse, necrotic pulse. The correct answer is option A, water hammer pulse. What is the most common cause of acute respiratory distress syndrome ARDS? Pneumothorax, sepsis, asthma, pulmonary embolism. The correct answer is option B, sepsis. A CT scan of the head shows a collection of blood between the skull and dura mater. Which type of head injury does this finding suggest? Subdural hematoma, epidural hematoma, intracerebral hemorrhage, diffuse axonal injury. The correct answer is option B, epidural hematoma. What is the recommended position for the patient when inspecting the legs for varicose veins? Supine, standing, sitting, lying prone. The correct answer is option B, standing. When a patient reports they feel pins and needles in their hands, they are experiencing paralysis, paresthesia, dysphagia, dyspepsia. The correct answer is option B, paresthesia. Which type of bandage is commonly used for a head injury? Circular bandage, spiral bandage, recurrent bandage, triangular bandage. The correct answer is option D, triangular bandage. Which test should the nurse monitor for a patient receiving heparin therapy? Hemoglobin levels, platelet count, prothrombin time, activated partial thromboplastin time. The correct answer is option D, activated partial thromboplastin time. What is the most common agent responsible for causing diarrhea in children? Adenovirus, rotavirus, salmonella, norovirus. The correct answer is option B, rotavirus. Which surgical procedure involves removing an entire lobe of the lung? Pneumonectomy, lobectomy, sigmoidectomy, thoracotomy. The correct answer is option B, lobectomy. A positive Homan sign may indicate deep vein thrombosis, peripheral arterial disease, lymphedema, none of the above. The correct answer is option A, deep vein thrombosis. What is the purpose of using anti-embolism stockings in a post-operative patient? To increase circulation to the legs, to reduce pain in the legs, to prevent deep vein thrombosis, to improve range of motion. The correct answer is option C, to prevent deep vein thrombosis. What is the most important electrolyte in intracellular fluid? Sodium, calcium, potassium, chloride. The correct answer is option C, potassium. Which lung cancer subtype is most common in non-smokers? Squamous cell carcinoma, adenocarcinoma, small cell carcinoma, large cell carcinoma. The correct answer is option B, adenocarcinoma. Substance used to counteract poison is called analgesic, antidote, antibiotic, anesthetic. The correct answer is option B, antidote. When a nurse performs an assessment using a stethoscope, they are conducting palpation, conducting auscultation, performing inspection, performing percussion. The correct answer is option B, conducting auscultation. What is the development of an embryo outside the uterus called? Ectopic pregnancy, miscarriage, intrauterine pregnancy, gestational trophoblastic disease. The correct answer is option A, ectopic pregnancy. Which of the following findings suggest venous insufficiency? Hair loss on lower extremities, brown discoloration near the ankles, diminished pulses, cool extremities. The correct answer is option B, brown discoloration near the ankles. ARDS is characterized by which of the following? Obstructive airway disease, alveolar inflammation and damage, bronchial constriction, pulmonary embolism. The correct answer is option B, alveolar inflammation and damage. What is the most appropriate intervention for a patient with dyspnea? Administering pain medication, positioning the patient in a semi-fowler position, encouraging bed rest for the entire day, restricting fluid intake. The correct answer is option B, positioning the patient in a semi-fowler position. What is the primary function of type 2 alveolar cells in the lungs? Gas exchange, production of surfactant, filtering foreign particles, regulating blood pH. The correct answer is option B, production of surfactant. Which type of cells in the retina are responsible for night vision? Cone cells, rod cells, ganglion cells, bipolar cells. The correct answer is option B, rod cells. Which enzyme found in infants' gastric juice helps in the digestion of milk proteins? Pepsin, renin, amylase, trypsin. The correct answer is option B, renin. Which artery primarily supplies blood to the trachea? Superior thyroid artery, pulmonary artery, aorta, inferior vena cava. The correct answer is option A, superior thyroid artery. Which part of the adrenal gland releases epinephrine, norepinephrine and dopamine? Adrenal cortex, adrenal medulla, adrenal papilla, zona reticularis. The correct answer is option B, adrenal medulla. Parietal cells are present in which region of gastric glands? Head, neck, base, none of these. The correct answer is option B, neck. What is the name of the gap between the motor end plate and the muscle fiber in the neuromuscular junction? Synaptic cleft, axon terminal, neuromuscular gap, motor neuron junction. The correct answer is option A, synaptic cleft. Volume of synovial fluid in knee joints is 0.1 ml, 0.3 ml, 0.5 ml, 0.7 ml. The correct answer is option C, 0.5 ml. Which cells in the retina are responsible for color vision? Rod cells, cone cells, ganglion cells, bipolar cells. The correct answer is option B, cone cells. The opening between esophagus and stomach is known as cardiac orifice, junction, fistula, pyloric orifice. The correct answer is option A, cardiac orifice. What is the primary function of the renal cortex? Urine collection, filtration of blood, production of hormones, concentration of urine. The correct answer is option B, filtration of blood. Which enzyme is primarily responsible for breaking down fibrin and promoting fibrinolysis? Thrombin, plasmin, trypsin, amylase. The correct answer is option B, plasmin. Which glial cells in the central nervous system are smaller than astrocytes and are responsible for forming and maintaining myelin? Microglia, astrocytes, oligodendrocytes, ependymal cells. The correct answer is option C, oligodendrocytes. Superior mesenteric plexus provides nerve supply to duodenum, kidneys, spleen, stomach. The correct answer is option A, duodenum. Which structure contains erectile tissue and plays a role in female sexual arousal? Uterus, clitoris, ovaries, fallopian tubes. The correct answer is option B, clitoris. The area of the retina with the highest concentration of cone cells is the optic disc, macula, sclera, cornea. The correct answer is option B, macula. What is the primary effect of ferrous hormone in the body? Increases blood glucose levels, reduces blood calcium levels, increases blood calcium levels, reduces blood phosphate levels. The correct answer is option C, increases blood calcium levels. During which stage does the hormone oxytocin stimulate uterine contractions to expel the baby? Follicular phase, ovulation, menstrual phase, labor. The correct answer is option D, labor. Which of the following muscles is responsible for extension of the fingers? Extensor digitorum, flexor digitorum, flexor digitorum profundus, none of the above. The correct answer is option A, extensor digitorum. Which lobe of the brain is primarily responsible for vision? Frontal lobe, parietal lobe, temporal lobe, occipital lobe. The correct answer is option D, occipital lobe. Insulin is produced by alpha cells, beta cells, both A and B, none of these. The correct answer is option B, beta cells. Which type of gland secretes hormones directly into the bloodstream? Exocrine glands, endocrine glands, sebaceous glands, salivary glands. The correct answer is option B, endocrine glands. The middle portion of the human sperm contains nucleus, proteins, centriole, mitochondria. The correct answer is option D, mitochondria. Which part of a long bone is primarily involved in bone growth during childhood and adolescence? diaphysis, epiphysis, epiphyseal flat, periosteum. The correct answer is option C, epiphyseal flat and metaphysis. The primary osmoreceptors are responsible for detecting changes in osmolarity are located in the hypothalamus, the adrenal gland, the liver, the pancreas. The correct answer is option A, the hypothalamus. The brain's protective covering is called the meninges, dura mater, arachnoid mater, pia mater. The correct answer is option A, meninges. The membranous labyrinth is located within which part of the inner ear? Cochlea, semicircular canals, vestibule, tympanic cavity. The correct answer is option B, semicircular canals. Which muscle is responsible for producing the six-pack appearance in the abdominal region? Rectus abdominis, external oblique, transverse abdominis, internal oblique. The correct answer is option A, rectus abdominis. Which part of the eye provides structural support and is known as the white of the eye? Iris, retina, cornea, sclera. The correct answer is option D, sclera. Which is the longest segment of the digestive system in the human body? Esophagus, stomach, small intestine, large intestine. The correct answer is option C, small intestine. Brachial artery begins at the lower border of teres minor, teres major, rhomboid major, none of the above. The correct answer is option B, teres major. The functional units of the kidney responsible for urine formation are known as nephrons, renal columns, renal tubules, collecting ducts. The correct answer is option A, nephrons. Which layer of the eye is responsible for detecting light and sending visual signals to the brain? Retina, cornea, sclera, lens. The correct answer is option A, retina. Which of the following is the largest salivary gland in the human body? Submandibular gland, sublingual gland, parotid gland, minor salivary gland. The correct answer is option C, parotid gland. Which chamber of the heart is primarily affected by prolonged systematic hypertension? Right atrium, left atrium, right ventricle, left ventricle. The correct answer is option D, left ventricle. Where is the gastroesophageal sphincter located? Between the stomach and the duodenum, between the stomach and the cecum, at the entrance to the stomach, before the external anal sphincter. The correct answer is option C, at the entrance to the stomach. Which of the following secretes secretin hormone? Esophagus, ileum, duodenum, stomach. The correct answer is option C, duodenum. What effect do glucocorticoids like cortisol and corticosterone have on the immune system? Stimulate immune response, suppress immune response, increase antibody production, activate T cells directly. The correct answer is option B, suppress immune response. Which type of neurons within the nervous system can initiate nerve impulses? Initiating neurons, relay neurons, conductive neurons, synaptic neurons. The correct answer is option A, initiating neurons. Which of the following is not a function of the stomach? Digestion of fats, digestion of proteins, mechanical digestion, storage of food. The correct answer is option A, digestion of fats. Where does the majority of fat digestion take place? Mouth, stomach, small intestine, large intestine. The correct answer is option C, small intestine. What is the outer layer of the kidney called? Cortex, medulla, renal capsule, ileum. The correct answer is option C, renal capsule. Cortisol levels typically peak at which time of day? Morning, afternoon, evening, midnight. The correct answer is option A, morning. The duct that carries saliva from each parotid gland to the inside of the cheek near the upper molars is called Wharton duct, Stenson duct, Bartholin duct, adenoid duct. The correct answer is option B, Stenson duct. The inner lining of the esophagus is composed of which type of tissue? Simple squamous epithelium, stratified squamous epithelium, columnar epithelium, cuboidal epithelium. The correct answer is option B, stratified squamous epithelium. Presence of RBC in urine is known as proteinuria, hematuria, nephritis, none of these. The correct answer is option B, hematuria. In the nervous system, what role does the neurotransmitter acetylcholine play at the neuromuscular junction? It inhibits muscle contraction, it initiates the firing of sensory neurons, it stimulates muscle contraction, it regulates blood flow to the muscles. The correct answer is option C, it stimulates muscle contraction. Which enzyme in saliva begins the digestion of carbohydrates? Pepsin, amylase, lipase, lactase. The correct answer is option B, amylase. Which bone forms the posterior septum of the nose, separating the nasal cavity into two equal facets? Ethmoid, vomer, sphenoid, maxilla. The correct answer is option B, vomer. Parkinson's disease is caused due to deficiency of dopamine, epinephrine, acetylcholine, endorphins. The correct answer is option A, dopamine. A patient complains of headache and neck pain. During examination, the nurse finds that bending the neck forward towards the chest is painful. What could this indicate? Migraine, meningitis, sinusitis, tension headache. The correct answer is option B, meningitis. Explanation: if a patient has a headache and neck pain and bending their neck forward hurts, it might be due to meningitis. Meningitis is an infection or swelling of the protective layers around the brain and spinal cord. It can also cause fever and sensitivity to light. Which position is recommended for a patient with increased intracranial pressure? Supine with the head flat, prone position, semi-fowler position, Trendelenburg position. The correct answer is option C, semi-fowler position, head elevated at 30 degrees. Explanation: elevating the head of the bed to 30 degrees helps improve venous drainage from the brain, reducing intracranial pressure while maintaining adequate cerebral perfusion. Other positions can potentially worsen ICP or impair venous return. Which electrolyte imbalance is most commonly associated with tetany? Hyperkalemia, hypocalcemia, hypernatremia, hypomagnesemia. The correct answer is option B, hypocalcemia. Explanation: tetany is a condition that causes muscle cramps, spasm or twitching. The most common reason for tetany is low calcium levels in the blood, which is called hypocalcemia. Calcium is important for proper muscle and nerve function, so when its level drop too low, it can cause the muscle to become overly sensitive and start twitching or cramping. Which organ is primarily affected by Wolff-Parkinson-White syndrome? Heart, brain, liver, lungs. The correct answer is option A, heart. Explanation: Wolff-Parkinson-White syndrome is a condition that affects the heart. In people with WPW, there is an extra electrical pathway in the heart that can cause the heart to beat very fast or irregularly. This can lead to episodes of rapid heartbeats known as arrhythmias. Normally, the electrical signals in the heart follow a specific path, but in WPW, the extra pathway disrupts this flow, leading to the abnormal heart rhythm. What does overstretching or tearing of a muscle or tendon refer to? Fracture, strain, sprain, dislocation. The correct answer is option B, strain. Explanation: A strain happens when a muscle or tendon is stretched too far or gets torn. This can happen if you lift something heavy, move suddenly, or overuse a muscle. It's like pulling a rubber band too hard until it snaps or stretches too much. Which instrument is used to measure intraocular pressure? Sphygmomanometer, thermometer, tonometer, stethoscope. The correct answer is option C, tonometer. Explanation: A tonometer is specifically designed to measure the pressure inside the eye, intraocular pressure. This is important for diagnosing and managing conditions like glaucoma. Which position is typically used for a sigmoidoscopy? Supine position, lithotomy position, Sims position, Trendelenburg position. The correct answer is option C, Sims position. Explanation: Sigmoidoscopy is a procedure where a doctor examines the lower part of your large intestine sigmoid colon using a thin, flexible tube with a camera. For this procedure, you are usually asked to lie on your left side with your knees bent, a position called the Sims position. This position helps the doctor get a clear view of the colon and makes the procedure easier and more comfortable for you. During a blood transfusion, if a hemolytic reaction occurs, what should be the first nursing intervention? Administer antihistamines, stop the transfusion immediately, increase the infusion rate of normal saline, inform the patient's family. The correct answer is option B, stop the transfusion immediately. Explanation: The first step in managing a hemolytic reaction during a blood transfusion is to stop the transfusion immediately to prevent further harm. Then the nurse should notify the doctor, administer supportive care such as fluids, and monitor the patient closely. Log rolling of a patient is typically done in which situation? To assist a patient with breathing difficulties, to reposition a patient with a spinal injury, to prevent bed sores in a bedridden patient, to help a patient with leg fractures. The correct answer is option B, to reposition a patient with a spinal injury. Explanation: Log rolling is a technique used to move a patient while keeping their spine straight and elegant. This is especially important for patients with spinal injuries or conditions to prevent further damage. Which type of soft tissue injury involves the stretching or tearing of ligaments? Fracture, strain, sprain, contusion. The correct answer is option C, sprain. Explanation: A sprain is when the ligaments which hold your bones together at a joint are stretched too far. This usually happens if you move or twist a joint, like your wrist or ankle, in an unusual or forceful way. It's like overpulling a roof until it gets damaged. Which of the following should you avoid when treating a soft tissue injury with ice? Applying ice directly to the skin, elevating the injured area, applying ice for 20 minutes at a time, none of the above. The correct answer is option A, applying ice directly to the skin. Explanation: when using ice to treat an injury, you should never put the ice directly on your skin. This can cause damage like frostbite. Always use a cloth or towel between the ice and your skin to keep it safe. Which of the following syndromes primarily affects connective tissue? Down syndrome, Marfan syndrome, Turner syndrome, Klinefelter syndrome. The correct answer is option B, Marfan syndrome. Explanation: Marfan syndrome is a genetic disorder that mainly affects the connective tissue in the body. Connective tissue is like a glue that helps hold everything in place, such as the skin, joints, blood vessels, and organs. People with Marfan syndrome often have very flexible joints, tall and slender bodies, and heart problems because their connective tissue is weaker than usual.